Hello and welcome and good evening to all of you, and welcome to the Functional Solution Podcast. My name is Tal. I'm the Educational Director at the American Academy of Functional Health, and with us we have Dr. Alice.
Hello, everyone. Good evening. Good afternoon.
And as usual, every Wednesday we join together to share the newest research, the most updated strategies for the functional and integrative approach. So if you are interested in learning about the root causes of chronic diseases and some clinical strategies you can help your patients, you're in the right place. So today we got a really, really important topic,
Mhm.
and I'm really excited about talking about this. Um, I think that every person that have been in clinical practice have probably learned about this topic, encountered this, but it's really great to dive deeper. And I know that, and this is really the topic of colon cancer,
Yeah.
right? And I know, Dr. Alice, for example, that you have been diving for the last few years into gut analysis
Yep.
testing, right? So, so this is really kind of all connected, right? And one of the interesting things about colon cancer is that so many patients feel, and also practitioners, a lot of practitioners that I talk to feel kind of um, that they're lacking tools to help those patients, right? Once they already have the diagnosis, or once they, or if they have the high concern of it, or something was found in their colonoscopy, right? And a lot of it is really because this mainstream approach, we don't talk about all the factors out and open,
Yeah.
right? And this is one of the reasons why it's so important to understand the root causes better and go beyond old age or genetic, right? Which is, as we know, that's what a lot of patients hear, right? When
Yeah.
they come to see us, right? They went from one primary care to another, one specialist to another, and eventually they end up in our office asking, like, what I don't know what's going on with my body, right? And a lot of time we ask them, like, what did your practitioner tell you, why about your disease? And they said, oh, it's because of old age, right? Or it's because my genetic, right? My father had this, or my mother had this, right? So we want to go beyond genetics. We want to kind of dive deeper into the root causes, which we're going to do today.
Yeah.
And there's a couple of reasons why we chose colon cancer. One, the prevalence it's quite prevalent, and when we look at the numbers in total, the statistics are showing us, according to one source that I've seen, close to 53,000 deaths every year in the U.S. alone, and from colon cancer. That means that there's an average of 145 patients dying every day because of colorectal cancer. And this is a really interesting topic that I started diving a little bit deeper into when, unfortunately, about 3 years ago, one of my family members have passed away because of colon cancer. And I can tell you, they went to experts, and did the treatments and tried everything they possibly could, and they end up passing away. So it's really unfortunate. And so, of course, the best medicine is prevention, and this is why we're here, right? But secondary to that, when the patient already have a diagnosis, it's really good to know all the different factors that cause in it. So maybe we can make it for us to make a bigger impact on their lives, right? So let's dive a little bit deeper into it. We can see, I'm going to show you the next picture. in terms of that will show you kind of the distribution of rates per state. So you can see here it's lower prevalence in the West Coast and higher prevalence in the East Coast. And of course, nutrition plays a role in the development of colorectal cancer. And it is a significant healthcare burden. So beyond the really high mortality rate, right, 145 people dying every day because of colorectal cancer, right? Beyond that, it's a significant burden on practitioners, on the families, financial burden, all of those, right? And so this is one of our biggest challenges. So let's take a look at another really interesting picture that will kind of show us the modifiable and non-modifiable diseases. This is from this was published. This is published in 2023. The study is called Colorectal Cancer from Risk Factor to Oncogenesis. And you can see on the left side the non-modifiable risk factors. So, of course, ethnicity, genetic mutations, if the patient have inflammatory bowel diseases or cystic fibrosis, those could increase the risk, right? And then the modifiable is really where we focus on in epigenetics, right? The sedentary lifestyle, if there's weight gain or obesity, right? We talked a lot in the functional weight loss training, which we have now opened the next class for June, right? When we talk a lot more in that class about metabolic dysfunction and the root causes and treatment strategies, right? But it's really important to remember that the fat tissue, the adipose tissue, is a metabolically active tissue, and it secretes certain hormones, and it secretes certain inflammatory cytokines, and it participates actively in our body's metabolism. So when a patient is overweight or struggle with obesity, it has long-term consequences, right? That can increase significantly and risk the risk of so many other factors. That's why we have so many nurse practitioners and physicians in that functional weight loss certification training, because they want to know how to help their patients beyond just here's a prescription, right? So there's a lot that we can do to help those patients. Now, diet, we're going to talk about one of the important dietary factors today. Of course, smoking, alcohol, if you got diabetes and insulin resistance, and then gut microbiome, of course, those are all factors. So let's do a little quiz real quick, just to kind of warm up a little bit. So which one of the following is not considered a major contributing factor to the development of colorectal cancer? Option number 1 is high consumption of red and processed meats. Option number 2 is chronic gut inflammation. Option number 3 is high consumption of dietary fat. Option number 4, genetic mutation in tumor suppressor genes. So which one do you think it is? Put it in which one is not considered a major contributing factor. You can put it in the chat. I'll give you a few seconds. Okay, and then the answer is number 3. So we know that high consumption of red and processed meats is a major contributor. There's multiple clinical studies that have shown that when it comes to dietary factors. If you have gut disorders, we're going to talk more about gut disorders today, and of course genetic mutations that can contribute to that as well. So now that we covered that, we completed our sort of like intro section, right? Now we really want to dive into the 2 major factors. So as I mentioned before, in functional medicine, what we always try to do is look beyond the standard of care, right? Beyond its old age or genetics, right? And also looking beyond the known factors, which is alcohol, and dietary factors, right? We want to actually understand why the patient that is sitting in front of us might have a higher risk of developing colorectal cancer. And if they already have a diagnosis, what else can we do? And this is really leading us to one of the major factors that we talk quite often on about with these with our discussions, live discussions, right? And so, Dr. Ellis, take us into the first functional medicine factor or root cause.
Absolutely. I'm so glad we're going through these root causes, because I think one of the stressful parts about dealing with or learning to manage colon cancer from a functional medicine perspective is dealing with the prevention. And we've seen so many more rates of diagnosis in younger populations, patients in their 30s and 40s and 50s, when this used to be a condition for the elderly, as you talked about. So our first functional medicine kind of root cause approach is going to be talking about gut dysbiosis. I think every week we talk about the gut. As you know, as functional medicine practitioners, you know, it all starts with the gut. But if you've been noticing a pattern, having more inflammatory bacteria sets you up for having more inflammatory conditions, chronic diseases, and cancer is considered a chronic disease. So let's start by taking a look at this image. It's from a 2022 study in the International Journal of Colorectal Disease. And I love this image because it gives a really beautiful illustration of how our gut bacteria can set the stage and create an environment that encourages the development of colon cancer. And as we talk about this and other root causes, we can think about how this may show up in younger populations, or how we can support a better or a healthier colonic environment in younger populations. So let's start at the left, the top left corner, a healthy gut microbiota. Each week, we've been talking about what a healthy gut looks like. Remember, we want to have lots of diversity, so a lot of different types of bacteria present. We want to have a lot of them as well, so not just a lot of different variety, but the number of species is elevated as well. And then we want to have more health-promoting bacteria present than inflammatory. And so as we move in a clockwise position, we'll see that the host health, so the health of the person, their diet and lifestyle, and even their environment can cause the development of dysbiosis. So again, the way that the patient is eating, if they're under a lot of stress, or even if they've been exposed to antibiotics for whatever reason, that can lead to gut dysbiosis. Now, because this changes the type of bacteria that's present in the gut, we're going to see changes in the cells in the colon as well. So when that microbiome begins to shift and we start to see more inflammatory bacteria, that's going to change the way different drugs are metabolized. It's going to change the way our cells regulate growth and death through autophagy. And it's also going to turn off our self-destruct mechanisms in our cells through apoptosis. And so what we're going to see is cells that are less likely to self-destruct, they're more likely to continue growing, even though the normal checkpoints that would be present would recommend that the cell die. And so we're going to see tumor growth. In some cases, some may develop chemoresistance, where that cell doesn't respond to chemotherapy drugs. And the change in the gut microbiome is going to change our immune response, because remember, our immune cells are designed to target cancer cells. But if the immune system is dysregulated because of our microbiome, that could impact how our immune system responds to the presence of cells that are growing in a rapid form. Now, as we continue around the in a clockwise position, we see here that a lot of the inflammatory bacteria make toxins, and some of those toxins can cause DNA damage. And that can lead to loss of function with the colon cells and development of leaky gut. And as you know, the more toxins are present and inflammatory bacteria are present, then we're going to see an increase in inflammatory markers and specifically inflammatory cytokines. We always tend to talk about interleukin 6 and TNF alpha, so some of the main inflammatory markers. And so making sure that your patient has a healthy, balanced microbiome is going to be very important. As that patient continues to develop and maintain a imbalanced gut microbiome, we're going to see an increase in immune system activation. That's going to lead to chronic inflammation. And then that further sets the stage for development of colorectal cancer. You'll also notice that sometimes the tumors can induce dysbiosis. So the tumor itself that can create an environment that promotes the growth of bad bacteria over good bacteria. So when you have a patient that comes into your clinic that either maybe has a family history of colon cancer and they want to reduce their risk or perhaps have a new diagnosis, it's going to be important to take a look at their gut microbiome, see where imbalances are occurring, and then begin to develop a protocol to restore a healthy function and resilience of the microbiome. So now that we've talked quite a bit about the microbiome and its connection to colon cancer, it's time for our second quiz. All right, so let's get ready in the chat. How does gut dysbiosis contribute to the development of colorectal cancer? A, it increases the production of anti-inflammatory metabolites. B, it enhances mucosal barrier integrity, so it helps strengthen that mucosal lining. C, it reduces oxidative stress. Or D, it alters microbial composition and promotes the toxin-producing bacteria growth and the presence of inflammation. So which of these, or how does gut dysbiosis contribute to the development of colorectal cancer? We'll give you all a few moments to put your answers in the chat. And hopefully you chose D. The correct answer is D. And as we talked about in that image, the gut dysbiosis changes the type of bacteria that's present in the gut, and that promotes the growth of the toxic inflammatory bacteria, and they begin to cause inflammation, and that changes the landscape of the gut and the colon. So, Tal, when you are supporting patients who either are worried about developing colorectal cancer or maybe are coming in with a new diagnosis, at what point do you introduce stool testing or looking at the gut microbiome?
Yeah, that's a really good question. So typically, as we learn in functional medicine, there's multiple different, let's call it imbalances or dysfunctions, right? That we're looking for in functional medicine. And essentially, that could be as simple things. I'll give a simple example. A patient that comes in and they have symptoms of bloating, abdominal discomfort, maybe smelly, kind of a smelly gas, right? So sometimes really simple, just as a simple example, right? That in so many cases could indicate that they have a imbalanced bacteria in their gut, right? They must be referred to as dysbiosis, gut dysbiosis, right? And that's easier to identify, right? That can lead to all sorts. That can release different toxins, and there's other conditions, right? Some things are harder to identify, right? Because, for example, if they have endotoxemia or increased intestinal permeability, or they have the migration of lipopolysaccharides from the gut, or maybe they even have insufficient production of the beneficial byproduct of this bacteria, which is referred to as one of those are short chain fatty acids, right? all of those and many of those that I just mentioned, there in most cases there's no GI symptoms that could indicate that, right? So I would say in general, when I do have GI symptoms, I would I would suspect the GI bacterial or microbiota imbalance, right? Remember, bacteria is just one thing. You can have different types of fungus overgrowth. There's multiple things that can go wrong in that ecosystem, right? But when somebody comes in with colorectal cancer or they're coming with inflammatory bowel disorders, this would typically be my go-to. I would typically recommend them. There's a lot of work that we can do, right? Dietary, some supplements, lifestyle-wise, but it's really good to get a snapshot of what's going on there, right?
Mhm.
And see where we are. Do we have some over toxicity? Do we have sufficient beneficial bacteria? Now, if you want to get there's Netflix actually did a really cool, which I would recommend everybody to watch. I don't know if you watched that. It's called the Hack Your Gut, Hack Your Health, the Secrets of Your Gut.
Yeah.
So it was really interesting. They actually took, because unfortunately most primary care providers are not trained in this field adequately, right? They took different practitioners, like a PhD, a guy that does PhD, and that's all they research for the last 20 years, right? His lab researches these species of bacteria, right? And they can now already identify by comparing species of bacteria in the gut of patients with certain conditions. Now they have a massive database, and he's sharing the story about, now by comparing those for years with the gut of healthy people, we can now start to identify which one of those bacteria, are associated with arthritis, with cancer, with IBS, with this, right? So we have there's like a massive database, and Genova Diagnostics and Doctors Data, both labs have access to those database, the different databases. But it's really cool because what they do in that show in Netflix, essentially, they take different cases, like somebody who's struggling with obesity, right?
Mhm.
And then they do a stool test, and they show them how certain type of bacteria is associated. And they talk about different. They got another guy there, a patient that lost their ability to regulate their appetite, so they don't feel hungry anymore, right? So they take different patients, different cases, and it's really interesting. And so I would highly recommend to watch it, because it really gives you like an overview of how much our gut is important. And now they're starting to dive in more into. There's actually practitioners. For example, there's a German physician who, that's what she does. She focuses her work on the gut bacteria and how that can contribute to health or disease. So highly recommend it. You can watch it on Netflix. So the short answer is, if they got digestion problems, chronic, we can get those labs for them, or they can order it for themselves. Remember, patients can order labs for themselves. They can just
Yeah.
go to Nova Connect, for example, and order their labs, right? Then I would recommend it, because it is, with some cases, I would say with all patients in my practice, we would use the functional health assessment. So that already patient fills it up. It's free to the patient. When you're a part of our community, the Academy gives you a lifetime license to use it on all your patients, which is really cool. So the way it kind of worked in my practice is, the physician or nurse practitioner would look at the form, the screening tool, the functional health survey, and they would look at which category has the highest symptoms. Do they have a lot of symptoms of gut microbiome dysbiosis? Do they have a lot of symptoms of maybe candida overgrowth or heavy metals or environmental factors or whatever it is, right? And then within like 2 to 5 minutes, they can already say, oh, like this, these are the top two things I want to focus on when I walk into the room, right? And then they also show it to the patient, so it's really visual. It's like, oh, look, you got a lot of symptoms of this, right? So that makes the patient straight connect, understand their symptoms and the root causes, right? So it's a great tool. And I know that you and Dr. Chill, you guys are doing coaching and mentorship with our community members, with the providers. So that's probably one of the first or second thing you showed them, right?
Exactly. Yep.
Yes.
No need to worry. We got them covered.
Yes, exactly. So you show them how to use it. And we typically tend to do that from the first month in the program, even because we want all of you out there to start building that functional medicine muscle, right? If we can call it that, which will allow you, with the guidance of Dr. Ellis and Dr. Chill, have been doing this for several years, to start fine-tuning your clinical, let's say your clinical intuition, and start identifying the pattern. It's like, oh, like this patient might have this, or they might have this root cause, right? And that gives you ability to dive deeper and offer more comprehensive care, obviously. So yes, so that's at least have been my approach, is that we do the general screening tool because that's free. We can use it on all the patients.
Yep.
But if they're showing up and they're like, oh, it's like they got inflammatory bowel disease, or they're concerned about colorectal cancer, or something popped up in their colonoscopy, I would typically talk to the patient and explain to them that there's a lot going on in the gut, and if we're not testing, we could be guessing, right?
Yeah.
So when it comes to somebody's health, I would not want to be guessing, because obviously they need to get their colonoscopy that on schedule and all that stuff. But it's harder to treat things once you already have a diagnosis, right? Especially when it comes to colorectal cancer, right? So that's at least our position. But I know that every practitioner does a little bit different. Do you talk to your patients, Dr. Ellis, a lot about the gut health testing?
I do. As a matter of fact, usually once folks have been onboarded into the practice, as one of the first set of labs we'll run. Mostly because my practice is really lies at the intersection between hormonal health, so endocrinology, gut health, and autoimmune disease. So all of those things kind of stem from gut health. So we start there and kind of branch out just to give everyone a good, healthy baseline to build off of. But when definitely working with patients who have an increased risk of colon cancer, I think that understanding the landscape of the microbiome is going to be very important in terms of figuring out what tools to use and what tools they actually need and can benefit from.
Yes, absolutely. And for sake of our conversation, we focus more on obviously on colorectal cancer.
Correct.
But there's one really interesting kind of a picture that stayed in my mind from watching the Netflix documentary Hack Your Health: The Secrets of Your Gut, which is they show this neuroscientist from England, right, who's been researching the impact of gut and the gut-brain axis and all that stuff. And he's talking about how they're starting to understand now that so many of the cognitive dysfunctions and mood disorders are actually starting in the gut, right, before they manifest in terms of symptoms and all that stuff, right? So it's really, really interesting to look at that approach. And of course, we have a specific class in our program that we have specialty classes that dive into mood disorders, neurological conditions, cognitive conditions, and of course, the gut brain, which is fascinating, right? Just to learn about how that impacts. So we're really starting to understand that what's happening in the gut does not just stay in the gut. It could impact other systems as well. So just wanted to mention that, but you guys should watch the Netflix documentary. It's a lot of fun. So so now that we've talked, and I appreciate Dr. Alice for talking about the gut and explaining to us about the different bacteria and what happens when things shift, right? Which could be symptomatic or asymptomatic. This is when we want to dive deeper into the second root cause. And remember, there's multiple root causes, but for sake of our discussion today, to keep it short, we're just going to focus on two. So the second root cause that we're going to dive into is chronic inflammation and metabolic dysfunction. So we've talked multiple times about inflammation. Inflammation is, at least in the functional medicine perspective, it is one of the driving forces of cellular damage, right? And it promotes this microenvironment that contributes or favors, right, DNA damage and cellular proliferation and angiogenesis, right? And so, and we also have to consider that with immune dysregulation that leads to chronic inflammation, we have, I would say, improper or subpar function of the immune function, right? The immune cells, which all of those together are just a recipe for tumor growth, right? And so let's take a look at this interesting picture, right? And the classical example that we can always talk about when you talk about inflammation is, for example, inflammation of the gut, right? Such as inflammatory bowel disorder or ulcerative colitis, Crohn's disease, right? So this is a study was published in 2016 in the Journal of Nature Immunology. So we got on two spectrums. We got, you can see on the left side, healthy individuals. On the right side, we have individuals with inflammatory bowel disorder. And so there's a lot of different details in this picture. So for now, I'm just going to summarize it in a way that is easy to remember and something you can take away from this. In patients with inflammatory bowel disorders, there's a risk of colorectal cancer is significantly elevated, right? And this is due to the persistent mucosal inflammation. And one thing we have to remember is that when we have chronic inflammation, right, we also have oxidative stress, right? Because what happens is all these inflammatory cells secrete reactive oxygen species, right? So there is an oxidation process that causes ongoing damage to our cells, right? So, and of course, there's the concept of senescent cells, right? So there's multiple different factors that can cause cells to become senescent, which essentially all that means is that the cells are there, but they're not functioning as they should be functioning, right? So they're sort of dysfunctional, right? And senescent cells, there is some association with accelerated aging and age-related diseases. So the inflammatory environment essentially is fueled by the release of multiple inflammatory cytokines. So we got pro-inflammatory cytokines such as interleukin-6, tumor necrosis factor alpha, and they activate oncogenic signaling pathways which promote the survival and proliferation of pre-malignant cells, right? And there's multiple studies that reported that previously. The inflammatory aspects also disrupt the normal immune surveillance, right, which allows for unchecked cellular growth and progression to carcinoma. So these are some of the drivers, right? But we have to remember that with inflammation, right, that's sort of like the recipe. With chronic inflammation, we got dysfunctional, right, immune response. On the other hand, we have the oxidative stress, which contributes to damage, right? And then we also have the angiogenesis, right? So we have increased blood flow into that area, right? So, and of course, DNA damage. So that's sort of like the recipe for those, for the development of colorectal cancer. Now, on top of that, we're also looking at metabolic factors, right? So let's take a look at this next picture. This is from the Journal of Gastroenterology. And the study is called Association Between Metabolic Syndrome and the Risk of Colorectal Cancer, diagnosed before age 50, according to tumor location. So this is a nationwide population-based study that was done in Korea. And interestingly, what they found is that elevated insulin and insulin-like growth factor 1 levels promote cell proliferation and inhibit apoptosis, right? So these are markers that are commonly dysregulated in colorectal cancer. Now, obesity, as I mentioned, right? I mentioned previously that the reason why it's so important for healthcare practitioners to understand the root causes, right? And the physiological impact of having a larger adipose tissue in a patient that is overweight or struggle with obesity is because the adipose tissue can increase the secretion of pro-inflammatory cytokines. And there's actually several studies that show that beyond messing up our hormones like leptin, adiponectin, and all of those other hormones, which, by the way, in the functional weight loss training, we learn about the immunological impact. So a lot of practitioners think about leptin as the hormone, the satiety hormone, or it's making you feel like you don't need to eat too much. It's related to your body weight. But when we dive more into the immunology of these different hormones, we learn that they impact our immune system very, very strongly, by the way. So it's important to remember that by impacting all these different hormones, right, and these inflammatory cytokines, right, they can, the adipose tissue can actually shift our body to a more pro-inflammatory and pro-angiogenic environment that just fuels that tumor growth, right? And that's really important to know. And of course, metabolic dysfunction can also contribute to oxidative stress, increase the production of reactive oxygen species, which can cause DNA damage, right? So that's really a big part of it. So if you really take home two things from this topic, is that if your patient have subclinical chronic inflammation, or it's very apparent that they have chronic inflammation because they have cardiovascular diseases, they have an autoimmune condition, right? A lot of providers even sometimes forget that so many other conditions are inflammatory. For example, so many patients go to their doctor, they have hypothyroidism. I've seen so many of those patients, they have hypothyroidism, and their doctor prescribes medication, right? Maybe a synthetic T4 or something like that. Their labs might look better, but the patient still struggles with symptoms of hypothyroidism, right? Their hair might be falling off, they feel tired, lethargic, depressed, whatever it is, right? And when we test them, we see that so many of them have high amounts of antibodies against their thyroid, right? So, and the surveys are showing us that up to 80% of hypothyroidism patients have Hashimoto. So we are forgetting sometimes that so many conditions out there, right, are inflammatory in nature, right? And so many of those patients, we have to sit down and explain to them that, yes, they technically have a diagnosis of a thyroid disease, but their disease is inflammatory. It's an autoimmune condition. They have a problem of overt and chronic inflammation. That's their problem, right? So that's what we need to focus on. What's the root cause that's causing it? So one thing is, remember, inflammation is a major player. The second thing, obviously, is that that's where a real functional medicine practitioner, trained practitioner, will know how to ask themselves what's causing that inflammation. Right? That's I always call it, like, that's the $1 million question. If we can figure out exactly what are the factors that cause inflammation with the patient in front of us, or immune dysregulation, or oxidative stress, or whatever it is, then the root causes, then we can essentially start what we refer to as more of a corrective care, right? Because until we remove those insulting factors, it's really hard for our body to heal, right? And it all makes sense, right? Because if you're seeing a patient with emphysema, for example, and they're coming to see your office, and they say, "Doc, I need some help. I'm coughing. I can't breathe. It's hard for me." And you prescribe their medication and a referral to a specialist, they say, "By the way, I'm still smoking about 15 cigarettes a day." What was the first thing you're going to tell them? That's pretty obvious, right? You're going to tell them, well, cigarettes damage your lungs, and they contain over 30 types of toxins, right? The first thing you have to do is remove that insult, that toxic, from your life. You have to remove it to allow your body to start healing or function better, right? Otherwise, the damage is going to be ongoing. So, but we don't do that with other conditions, unfortunately. We don't look at the whole picture and look at the patient and ask what other things we need to remove from their lives to allow their body to heal, and at best case, and at least to prevent the ongoing damage, right? That's really important. So let's finish up this section with a quiz. So which one key mechanism by which chronic inflammation promotes colorectal cancer? So you should know this, no stress. It's just a little pop quiz. But how does chronic inflammation promote colorectal cancer? So we just talked about it. So I'll give you four options. One, inflammation stimulates insulin secretion, which suppresses tumor growth. Two, it promotes an angiogenesis and DNA damage through cytokine signaling. And C, it enhances body anti-tumor immune response. And four, it increases colon mortality and reducing exposure to toxins. So which one is it? I'll give you a few seconds to think about which one of those is the correct answer. You can put it in the chat, share with us your thoughts. We'd love to hear from you. Okay, so the answer is B. Inflammation promotes angiogenesis and DNA damage through cytokine signaling. And we talked about a little bit about a couple of those pro-inflammatory cytokines, interleukin-6 and tumor necrosis factor alpha. But there's so much more beyond what we talk about here, which we do mostly in the advanced and clinical functional medicine program. So this is where we want. So we talked about two major factors. Now we always, because we stay focused on the clinical application, and when we teach, and when Dr. Alice and Chill are also doing the including the integrative part when they're coaching, not just functional medicine, but also integrative medicine. So in integrative medicine, we love to talk about what other natural alternatives patients can use for their conditions, either for prevention or when they already have the diagnosis, right? So, and this is really important for all of us, because functional medicine is amazing, and the root cause is something that every practitioner should know. However, when a patient is sitting in front of you, we don't want to wait 2 or 3 months until we get the labs and we figure it out and we start working on the root causes. That's going to take some time to deal with the underlying factors. So we want to offer them something they can start using right away to start improving their and restoring their health. Right? They're in front of you. They came in for assistant, right? So that's exactly why we're finishing this discussion for today with actual supplements you can use, you can recommend, you can look into for your patients. So Dr. Ellis, this is exciting. I mean, we know we had some really cool studies and we got some really cool factors that we can look into. And I know that the first one you're going to talk really goes hand in hand with the study you just previously showed, which is related to gut microbiome, right? So, take us into it.
Wonderful. Yes. So the first recommendation we are going to do and work with probiotics, but I wanted to kind of explain a little bit about how I like to use probiotics, particularly in a preventative way. So there are several different types of probiotics. Usually they are made of lactobacillus species, much like the one we'll talk about today. There are also some that belong to the bifidobacterium species group. And then there are also bacillus spores. The way I like to use probiotics in practice is you want to have a foundational probiotic that will help maintain good, healthy levels of bacteria. And then you can add on specific strains for specific reasons or activities that you want. So ideally, you want to have a go-to probiotic. I mean, we talk about different brands and how to choose those inside of the program. So if you haven't logged in a while or checked the dashboard, log into the Advanced Clinical and Nutrition Functional Medicine program so that you can refresh your memory on probiotics. But today, we'll specifically talk about one specific strain, Lactobacillus rhamnosus GG, also known as LGG. So this is a unique strain of bacteria. It's one of the most researched strains of probiotics in research. And so it has been studied for its impact on reducing inflammation, specifically used in combination with a fiber and also called symbiotics to assess their efficacy when it comes to reducing colon cancer risk. Now, one thing I wanted to point out is this product is by Pure Encapsulations. We don't have any associations with any brands, but I wanted to point out that each brand is going to have a difference in dosing. So this one in particular is 25 billion colony forming units, or CFUs. And what's important to understand is the more CFUs a product has does not necessarily mean that that's the strongest or is in direct correlation with the strength of the probiotic. It's just a reflection of how many different unique colonies of bacteria will be there. And then you also have to factor in diet and colon environment for survival as well. So when choosing a product, choose one that has a lot of studies and data on their efficacy. So there was a randomized placebo-controlled trial that looked at Lactobacillus rhamnosus GG and in combination with a fiber. And it's the way that they wanted to measure the way in which it changed the colon mucosa. So that protective layer of mucus that keeps our colon cells healthy. It also looked at its impact on the gut microbiome profile and the expression of genes that are associated and linked to inflammation and carcinogenesis. And what they found is when they combined the Lactobacillus rhamnosus GG with a common prebiotic fiber, they found that this consumption led to a positive change in the gut microbiome. In fact, it increased levels of beneficial bacteria like Lactobacillus, Bifido, and many others, especially those that make the short chain fatty acids that keep the inflammation down. There was also a decrease in cancer promoting biomarkers. So they looked at different types of secondary bile acids. We'll talk about that in the modules as well. And they also looked at markers that are associated with cell proliferation changes. So they saw a reduction in those. And they saw that the pro-inflammatory gene expression was also decreased. So this showed great potential and supporting the use of probiotics and prebiotics to help support a healthy change in the microbiome and reduce inflammation and the inflammatory pathways associated with colorectal cancer. So Dr. Tall is going to talk about another strategy and recommendation that we can use in clinic that's actually super easy and ties in perfectly with the probiotic recommendation.
Probiotics, even having, like, I always said this, every strategy we learn and is like another tool that we can offer in our toolbox to the right patient, right?
Yes.
And it's really all about what can we stack up together to improve the clinical outcome, right? So, I love that you mentioned Lactobacillus rhamnosus, because there's actually there's so many interesting studies about it. We're going to post the link to, if you want to read more, we're going to post a link right now to another interesting study that showed, this was published in the Journal of Molecular Oncology, and it actually showed that Lactobacillus rhamnosus GG activates the innate immune receptor. So that receptor is called 4-meal peptide receptor 1. And it activates the immune resolution that dampens the angiogenic response of colorectal carcinoma cells. So if you want to read more, the study is called Probiotic Lactobacillus rhamnosus GG Restrains the Angiogenic Potential of Colorectal Carcinoma Cells by Activating the Pro-Resolving Program. This was published in the Journal of Molecular Oncology in 2022, so just fairly recent. So again, this is a simple, it's not expensive. Pure Encapsulation is a professional grade company. All our recommendations are based on clinical studies. And this is relatively a newer field going into functional medicine with oncology. As interestingly, all of the different 3 programs that I went through before I got to the academy, none of them ever talked about cancer, which was really interesting. Which is unfortunately, it's so common. So now this is why it's so important for you to be here, because you learn about the root causes, the prevention, and then some simple strategies your patients can already start using. So the last strategy for today is fiber. Fiber is really, really important. We're seeing in so many surveys that Americans have less than half of the required consumption of fiber. And so insufficient fiber is associated, consumption of insufficient fiber is associated with increased risk of colorectal cancer. And when in fiber, there's multiple reasons for that. One, on the simple nutrition one-on-one, right? Fiber increases the stool weight, decreases the transit time, right? Dilutes the colonic carcinogenic content, right? There's also an association with decreased adipose tissue, right? But when we go beyond that in functional medicine, we learn that we learn about all these different bacteria and what they do, the ones that are beneficial and help you in your gut, right? Help you to metabolize carbs and produce short chain fatty acids and anti-inflammatory compounds and compounds that regulates our immune system. So fiber is really one of the fundamental foods that we should eat, and we should eat more of, right? And one of the cool things that I was reading in one of the articles, when we created a training for which you can access in the Advanced in Clinical Functional Medicine. So we created a training specifically for functional medicine for pediatrics, right? And this was training that was created with three different experts in functional medicine. Like one of them is a functional medicine pediatrician with over 20 years of experience. The other one is a physician that specializes in integrative medicine. And one of the things that I remember taking from those classes is that the gut bacteria is the first place that our immune system is trained to identify a friend or a foe in the first few years of our lives, right? So I just want you to kind of wrap your head around it, that the way your immune system is functioning is essentially so much impacted by the first few years of your life and the foods that you were eating and what your gut bacteria was doing with that food. Remember that 80% of our immune cells are in our gut, and that's initially what's helping us to regulate healthy immune system. So if you want a healthier immune system, you have to start at the gut, right? So fiber is so important, and I can share with you a quick picture here to understand why fiber is so important. So this is from the International Journal of Molecular Science from 2023. And you can see here that dietary fiber essentially there's dietary fiber that we cannot process, right? We cannot break down, but our beneficial bacteria can break down. Now, if you eat sufficient amount of those dietary fiber, they actually get to the large intestine. That's where there's a whole different ecosystem from the small intestine. There's a whole different ecosystem in our colon, which now ferments that into what you see on the bottom right, short chain fatty acids, which lower colon pH, has anti-carcinogenic effect. For example, one of these short chain fatty acids is butyrate, which is really important. And the cool part about it, as a functional medicine practitioner in our program, you learn specifically, I think it's in the first module 5, I think it's class 5 or 6, you learn about it in the first 2 or 3 months, right? How do we identify through functional medicine lab testing? How do we identify what our patients are missing? Are they missing any one of the 4 essential short chain fatty acids? Are they missing? Do they have markers of inflammation? Do they have markers of toxicity? Do they have markers of, do they have high lipopolysaccharides? Do they have, like, what's going on there? Do they have the beneficial or the unbeneficial bacteria? So we have enough data in our databases, and those vendors, those labs, specialty labs vendors already have enough data to identify and to highlight and to let you know. And of course, we have to go beyond the lab testing, right? We have to understand the treatment protocols and what we can do, right? So that's really important. So when you encounter a situation of dysbiosis, like, you can look into our clinical guide and say, oh, there's dysbiosis, there's excess candida, there's insufficient short chain fatty acid, and Dr. Chill and Dr. Ellis are here for you to provide you with specific guidance. We have a HIPAA compliant portal. You can upload patients' labs, and we're here to help you. This is a part of your program, so take advantage of it. So if you listen to this and you have not scheduled your coaching call, please do. You can do that. Log into your platform. On the right side, you can click on scheduling your call. So this has been really, really interesting.
Yeah.
And What I wanted to mention is there's for patients, when we talk about dietary factor, obviously eating fruits, vegetables, legumes, whole grains, right? It's an amazing way to increase the consumption of fiber. Um, and there's a really cool study that Dr. Alice put in here for us, and I wanted to kind of give you the essence of it, because this is so critical and such a simple strategy. I wish more primary care providers would talk about this, especially with patients above the age of 40. It's so critical to talk about this stuff. But this is from a meta-analysis that was done in 2011. And essentially, what they found, they did an analysis. The study is called Dietary Fiber, Whole Grains, and Risk of Colorectal Cancer, Systematic Review. And I'll highlight it here so we can post it. I'll highlight it here in yellow so we can post the name of the study if you want to read it. And what they found, so they reviewed 25 prospective studies, as the follow-up was 16 years, right? And they looked at how much dietary consumption of dietary fiber can impact the risk of colorectal cancer, right? And they adjusted all the other risk factors like age, gender, BMI, consumption of red meat, smoking, physical activity, like all of that other stuff, because they want to really narrow it down to like this one thing that you can take and start applying, recommending all your patients. What they found was phenomenal, and I'm highlighting it here so you can visually see the results. So the result was that for every 10 grams a day of increase in the total fiber intake was associated with a 10% reduction in the risk of colorectal cancer. And that's huge, because, you know, it's not expensive. It's 10 grams of fiber is easy. Just start your plate with a vegetable, finish your meal with a fruit, right? It's not hard. Now, of course, some patients would walk in and say, well, you know, maybe they're not ready to change their diet, and that's okay too, because there's supplements today of fiber. They can add it to their shake. They can mix it with juice. There's supplement of simple. They can get like 10 to 20 grams in a simple tiny spoon. So there's other ways, and we always have to think outside the box. Where's the patient is? Do they just want supplements? Is that where they are? They just want supplements and feel better, and then now they're a little bit more open to it, or they're open to also dietary and lifestyle changes, right? So if you take one thing from that, is eat more fiber. Right? That's going to be, you can change the world with 2 or 3 good strategies, right? And that's what we always say. So so we're about an hour and 10 minutes into it. So we are going to kind of summarize everything. And if there's 1 or 2 questions in the chat, if you got 1 or 2 questions, put it in the YouTube chat. Share with us what's your go-to maybe supplements for fiber. What's your go-to way to increase fiber consumption? What's your experience with colorectal cancer patients? And if you got specific question for us, put it in the chat. We'd love to take a look at that and answer. And as usual, if we summarize it, when we go in functional medicine and integrative medicine beyond genetic, it's your genes or your age. It's really comes down to, there's probably 4 or 5 different factors that driving colorectal cancer. We talked about 2 today, which is Dr. Ellis talked about gut dysbiosis, imbalances, and then I talked about inflammation. And then we talked about 2 supplements that are really important, right? Dr. Ellis, what else did you want to mention about this topic?
Yeah, I love that the recommendations that we offered weren't complex. very simple, straightforward, easy to implement with diet. I'm so glad that we talked about that study, because when I was, researching and preparing, I was just stunned at the data, especially when they found that cereal fiber was more protective than fruit and vegetable fiber.
Mhm.
And so it just gives us more data to help encourage patients, especially those who are a little bit resistant or hesitant, to make those dietary changes. Now we have more data to show that it's not just the cool, trendy thing to do. It is very
Mhm.
important for our health.
Absolutely. And one of the biggest, um, I used to always look for the shiny object. It's the
Mm.
shiny object syndrome, right? I used to look for functional medicine labs and the specialty labs and all that stuff. And as I was going through the training with the nutritional aspect, the more of the integrative aspect, right?
Yeah.
And you learn Dr. Chill and Dr. Dave and some other folks who do a lot of the nutritional work in the nutrition as medicine. For example, there's a simple example: nutritional medicine, right? Small tips of understanding how certain diets can impact our microbiome, like if a
Mhm.
patient follows the Mediterranean or ketogenic or paleo or whatever that. And small things could be so important. Like one of the tips I took from that class was a lot of patients eat out, right?
Mhm.
It's known. A lot of us eat out because people eat, they have an hour break or 30 minutes break, and a lot of people don't bring lunch, so they go out and they buy lunch somewhere, right? And so a lot of my patients, when I asked them, how's your, where do you eat lunch or where do you eat dinner? And they would say, oh, lunch, I eat out. And I would be like, okay, what are your options? And they would be like, oh, I typically do burger and fries, right?
Mhm.
And we know, okay, red meat increases the risk of colorectal cancer. French fries, it's high in omega-6. It's not to talk about rancid oils and all that stuff and vegetable oils that are highly processed, but in the simplest way, it's like, okay, well, do you have, let's talk about some other options. Do you like Chipotle? Do you have Chipotle around?
Mhm.
And they're like, yeah. And like, okay, great. What about, what are your thoughts about some diversity? Like maybe a couple of days a week instead of doing the burger or the chicken or whatever it is, stop by at Chipotle and get one of their brown whole rice with some beans. And they have some chicken. If you want to add some chicken and stuff, you can add some chicken. But then we know that just by doing this small, tiny adjustment, and in patient's mind, it's still fast food, right? Because it's like tuck, tuck, tuck. You put it in, it's in a plate or a burrito, and it's served, right?
Yeah.
So in the patient's mind, it's still fast food, but in our eyes, as functional or integrative practitioners, we know the nutritional value now has been like 3 or 4 times the fiber, right? So just making this simple, like one simple strategy, you can double or triple the amount of fiber you consume in the amount of phytonutrients, right? So,
Mhm.
so yeah, so keep on, and this is why I love having you here, because it's like everything you learn can be applied to help the next patient you're going to see tomorrow morning or tomorrow afternoon, right?
That's right. Exactly.
So everything we talked about, especially with gut, we got a comprehensive training that is you know that is made by the leading expert like Dr. Liz Lipsky, who was a part of creating the initial functional GI. She's the authority national wide. Dr. Coviola is amazing. So we got multiple presenters. So log into the platform, the Advancing Clinical Functional Medicine, go into these modules, start understanding the gut in a much more deeper level, and especially the other factors that we talk about. And if you're interested, you have questions, you're interested in more information, let us know. We also, as I mentioned, we just opened enrollment for the functional weight loss certification. So this is a really cool 2 months certification. It's starting in June 4th. It's really cool certification. It's 2 months. It's 1 hour every week. We meet together like we did just now, right? But it's a little bit more structured. So in the functional weight loss, essentially we focus more on the 5 root causes of weight gain. There's the specialty testing for more specifically metabolic dysfunction and weight gain or obesity. And then we talk about a lot of strategies. So it's 8 weeks. Every week we dive into one root cause. And then we also have specific topic about nutrition, probiotics, how to optimize metabolism, GLP-1 agonists that are natural, right? And it's 100% online. So every week we meet for about an hour to an hour and a half. It's live. And then there's also lots of great resources that we offer in the specific platform, the functional weight loss platform. So that's awesome. You guys are invited to take a look at that. And we have a $2,000 scholarship that we offer healthcare practitioners for that program. So reach out to us if you want more information. And I wanted to finish by mentioning that we have the phone app that is coming out this month. So we have the Functional Integrated Medicine phone app, iCare TX. And so it's going to have all the treatment protocols. And for everybody that enrolls this month in the advanced functional medicine training, they'll get that phone app as a gift from us. And then all you got to type in is whatever it is. We got all sorts of autoimmune and diseases and chronic symptoms. And they got a headache, you type it in. If you got type 2 diabetes, they type it in. All the way to different types of cancer, pediatric condition. We got specialty conditions such as neurological and mood disorders. We got hundreds of conditions. It's pretty awesome. It's all at the tips of your fingers. So Jacob, can you show the some of the bonuses that we're having with the advanced functional medicine? So the iCare app is really cool. It's got specialty classes and videos and articles and all that cool stuff. You can also connect with other healthcare practitioners. This has been in the working for the last 4 or 5 years. So it's really, really cool. So you got all the treatment protocols, videos, and then you got the you can search for a treatment protocol for a certain condition. Jacob, can you show the bonuses that we're doing this month? This is really a big part of the enrollment this month. So we are offering the self-paced 100% online program, the advanced program. This is only open to healthcare practitioners. This is not a coaching level program that is open to everybody. It's really only open to healthcare practitioners. And you can see the treatment protocol phone app is a part. You get access to that as part of the bonus. And of course, you get coaching and mentorship with Dr. Ellis and Dr. Chill. And we also include the practice building classes for you. Now, when you're in the program, make sure to go in and schedule your coaching call with Dr. Ellis. And sometimes practitioners ask us, if I'm just starting to build my own private practice and I'm so excited, I want to do virtual, or you can start by being your first case study, right?
Yeah.
Right. So Dr. Ellis is gonna show you where to find the clinical survey, the functional medicine survey. It's great to fill it up. I did it myself first a few years ago. And then it's great to see which areas in your body you might not be aware of or need some work, right? And then my second person I used that was my father, who at the time had some health challenges, and we wanted to make sure that he's getting better, helping him to restore his health. So we use the same tool, and then you can use it on real patients too. So if you got friends, family member, somebody that needs help, you can use that tool to help them and schedule a call. You can do it for yourself or a patient. So
Yeah.
Amazing. So
Absolutely.
Yep. So I want to thank Dr. Ellis for putting this together for us, and lots of resources. It's been amazing. And I want to thank our media team for putting this together, for allowing us to be with you wherever you are. And I want to thank you, all of you, for continuing to advance your skills and offering truly comprehensive care that is focused on prevention, health, and wellness, and going beyond just a prescription and sending them home, right? We're looking at long-term improvement and how we can, help as many as we can, save as many as we can, really change people's lives. So really appreciate for being there for your patients every day. And we will continue to see you in the platform, in the training, and with the live new trainings that we have. One last notice I wanted to mention is next Monday for our community members, we have a special class with Professor Julie Kirk. And awesome. That's going to be incredible. So that's on Monday at 4 p.m. Pacific time, 6 p.m. Central time, 7 p.m. Eastern time. And Professor Kirk she's a professor of pharmacology, and her subspecialty is the interaction between drug and herbs. So she is prepared for us an amazing presentation that will take you into how to practice functional and integrative medicine better and safer. And it's a really, really important class. It's about an hour and a half. I would highly recommend it to any practitioner, not just functional and integrative medicine practitioners. Remember that any primary care provider, I looked at some of the statistics from her presentation, and 8 out of 10 adults in our country today are taking supplements. So it is important. They might not disclose to you, but it is important to understand when you put them on a prescription, what else are they taking, so we can properly address that, right? And Professor Kirk is going to talk specifically about what are different alternatives, and going to talk about cardiovascular medication. She's going to talk about metabolic medications. She's going to talk about different medications, the top 5 that you should know of. So you guys are going to get an email tomorrow with some additional information about this lecture. It is free to all our community members, and you're going to get access to that through the portal. So stay tuned to that, but that's coming up next week on Monday evening. So I just want to let you know. And thank you again for being here. Thank you again, Dr. Ellis. Appreciate it.
Thank you. Absolutely. Have a good night, everyone.
Yes. Have a good night. Bye-bye.